Please remember, this is not therapy. It does not replace a relationship with a qualified mental health professional.
I'm Dr. G, and we're here with Engaging Minds. Every week we like to look at our what we're dealing with in the world from a deeper psychological point of view. And if you want to call in, our number is 1-800-222-5222. And what we're going to look at tonight is two things. We're going to look at an update of the California Right to Die Act. I've been getting a lot of emails, people asking me questions. What is it about? They don't really understand it. So we're going to clarify all that in the first part of our show. And then we're going to talk about something that I think is kind of fun. With the summer coming up, I get a lot of patients come in. They're feeling a lot of pressure to look their best. And I wanted to say to them, you got to look your best, but you also got to feel your best. So with that, I wanted to understand our body psychology, how we can look and feel the best we can possibly be. So with that, I brought a panel of experts together that I'm excited to have on, and they are Dr. Cary D. Nelson. He's a board-certified family practitioner. He also works with Mid-Valley Hospice and focuses on the Right to Die Act with them. He's also into aesthetic medicine, so this guy's got a lot of talent, and we're going to hear from him throughout the show. And then we have Lisa Defazio. She is a registered dietitian and a media expert, nutritionist. She's going to explain to us how you can feel beautiful from inside and out. And then fellow psychologist, Dr. Jennifer Schneide. She's a clinical psychologist. She focuses a lot on eating disorders, body image. So as you can see, she's going to be able to contribute a lot to our show. So why don't we start off with Dr. Nelson? I wanted to bring you back on the show because, as I said, I'm getting a lot of emails, questions from people trying to understand the Right to Die Act, and they have all kinds of issues around it. So I needed some clarity, so that's why I wanted to bring you back on. So can you please explain it to our audience, what it's all about?
Sure, Howard. Thanks for having me back on.
It's a pleasure.
Thank you. So the End of Life Act is a pretty clear-cut act in California. Basically, in this act, the patient has to have a terminal diagnosis with less than 6 months to live, has to be considered of sound mind, and not being forced to make this decision, and it has to be discussed with not only their attending doctor, but another physician at a later point in time. The whole process takes roughly about between 20 and 30 days, depending on availability, et cetera.
So this is something that has to be planned usually in advance, like a person knows they have a terminal illness, and so they make plans for it. It's not an impulsive act.
Absolutely. These are very sick patients who either have, let's say, for example, terminal cancers, where they've exhausted chemotherapy, they've exhausted radiation, and they're at the point where there's not anything left for them but comfort measures. That can be a long, winding road for many folks that lasts more than 6 months. But that's considered, in many cases, to be terminal and a 6 month or less to live sort of situation.
Right. That's the issue that a lot of people bring up, is this sense that people will be coerced into it, maybe by family members, and they may change their mind at the last minute. So what are the balances and checks around that? Sure.
Certainly the physician that interviews the patient, the hospice physician or the attending physician that first interviews the patient, asks the patient clearly questions to test their mentition, and if they prove sound, the patient has to actually express the wish out of their own mouth. It's that simple. It can't be coerced by the physician. It can't be coerced by a family member. The patient actually has to express that this is something that they're seeking, and they want to know more about it.
Now, what happens if a family member is against it, or a spouse? How does that play out?
That's something where we discuss with the patient first. Patient comes first. It's patient-centered. But if there's a family conflict, we like to try to gather them to have a family meeting. Hopefully they'll discuss with one another before the next visit or before the patient goes any further with it. But usually the patients are pretty set in these situations.
So I was told, can a patient actually plan out exactly sort of when they want to die, like on a Sunday afternoon at 2 o'clock?
Sure, we've had patients get to relatives' birthdays and their own birthdays even before doing the act. And I also want to mention that you had said something earlier about if they change their mind. Well, there is no time limit to when the act can be finalized. In other words, the act takes place in 3 parts. Basically, the patient expresses their wishes to a physician at one visit, uncoerced, and then a follow-up visit is made by a second independent physician. And again, the patient has to express their wishes that this is something that they're looking for. And then finally, the original physician comes back and re-interviews the patient, and the patient again has to express their wishes. So it's a 3-part situation.
So that answers a lot of the emails that I got, is people asking questions about, the impulsivity of it. Is it something that someone just decides to do and it's done the next day? And obviously it's not. No, it's something that's well thought out. Now, the other big issue is, I'm sure you know that people are divided ethically on this. Some people feel it's not a humane act. Other people feel it is. So I'm wondering what your thoughts are around that.
Well, based on the types of medications that are delivered to these patients, these are comfort medications. Basically, the patient takes the medication either in most likely it's in a suspension or some sort of liquid form, and they fall asleep permanently. It's very peaceful.
Oh, okay, but do you think that people have an issue that people shouldn't have a right to do that when they're terminally ill, that it's not God's will, or they have religious beliefs that go against it? So I'm wondering, again, what your thoughts are around that.
Well, again, we'll try to separate church and state here.
Yes, we are.
And physicians are supposed to do so. We take an oath to practice ethically, but this is ethical. This is humane.
Well, that's my feeling about it, is that it's humane, and that you're just offering an option. If someone has big issues around it, they don't have to choose it.
Sure, and we've had families divided who at the end of the day come together over it because they see that this is their loved one that's suffering.
You're right. This is our loved one, and I see some nodding. You can't see it because we're on the radio, but I wanted to address our 2 other guests to chime in on that. Jennifer, Dr. Nelson was talking about families dealing with stress as an expert psychologist. What would you recommend to families who are dealing with stress at this juncture or this phase of their existence?
Sure. Well, I definitely think that caregivers face a really unique challenge in that they are there to provide support and care, and sometimes physical care, to their loved ones. And it's really challenging to balance that with also taking care of yourself. And sometimes they can put their own needs on the back burner, especially in a situation where there's a terminally ill patient and they feel that, it's just a matter of time before this person is no longer with us, and I want to give them everything I possibly can before they're no longer here. I
think that's a great point, but you have to be able to take care of yourself in that process. I know that we're taught that as psychologists. People ask me all the time, how do you do what you do? And I said, lots of breaks.
Lots of self-care.
Lots of self-care. And I was going to ask Lisa, too, as an expert nutritionist, dietitian, if people are facing this issue, how can they make sure they take care of themselves from a nutritional point of view?
It is a challenge because, of course, they're emotionally drained and 24/7. They're probably not sleeping. They want to be there for their loved one, but they need to eat right, make sure they're keeping their energy up and their strength up so they can be there for their loved one.
So how would you define eating right?
I think many times they're probably skipping meals. They're probably stressed themselves. I think getting proper rest, eating at least 3 meals a day, maybe some, even if you have to have a smoothie or a meal replacement supplement, something like that, because blood sugars can drop. You're going to be more irritable and moody. You're not going to be emotionally strong if you're not eating right either.
You know what? That's such a great statement. I want to talk about it for a minute. We actually have just a couple minutes left before break. Actually, 1 minute before break. But the sense of you need to be emotionally strong. And that's what Dr. Nelson is saying. That's what Jennifer is saying. And that's what Lisa's saying. So if you're dealing with this kind of issue, you got to take care of yourself. And you could see that it's something that is really well thought out and gives people an option. So If you want to find out more about a hospice that offers this kind of service, you can contact Mid-Valley Hospice. Their number is 818-386-2600. They're compassionate at what they do. Ask for Anna, and she'll take you through the whole process. And again, I want to say that this is one of the most humane things I think we could do at the end of someone's life is offer them a choice. And what our panel is saying, make sure you take care of yourself in the process, because you want to be there, not just time-wise, but you want to be there for quality-wise and want to be your best you can be. We're talking about body psychology with the summer coming up, that we feel good both internally and externally, but I want to share a little anecdotal story, something that inspired me to do this story on the air. Is I've been working with a patient a long time, and I work in bariatric surgery. I do intakes for people that have to have the weight loss surgery or choose to do it. And I worked with a woman for a while, and she lost about 100 pounds, and she was never able to buy what she called regular clothes. And she had lost all this weight. She went into a store. She was able, for the first time in probably 20 years, fit into something as she called regular clothes. And when she put it on, she burst into tears and had a panic attack and had to leave the store, especially when one of the salespersons said that she looked pretty great. And what it brought up for her was a lot of internal self-hatred, that she had been so obese for so many years. She had such low self-esteem that when someone actually said she looked pretty, she didn't know how to deal with it. It caused panic, and I've heard that from other people. So we worked for a long time to help her deal with some of those issues, and also, as I said, find that internal beauty. So when she looked in the mirror, she also felt good about the way she looked. So with that story, I wanted to address Lisa.
Yes.
Hi, Lisa. So any thoughts about that story? You know, as a media expert, someone who's worked a lot in the nutritional field, I'm wondering if you had any kind of similar stories and how you would deal with it from a nutritional point of view.
I've also dealt with a lot of bariatric clients and, individuals that have been overweight for many, many years. I often tell my clients that they need a therapist in addition to seeing me, because, it's not about the meal plan and the diet oftentimes, and there's so much attachment to food and upbringing and how they got here in the first place and childhood, as you know. So, it's an exciting time because they finally reached their goal, but at the same time, they're like, wow, they can't really handle it. And
one of the things I found working in this field is that people get very attached to certain foods.
Yes.
So when I do the intakes, I'll hear them say, well, do I have to give up my Coca-Cola? Mm-hmm. And I go, well, no, but if you want to live a little bit longer, you might. But the emotional attachment to food is very difficult.
Definitely.
Dr. Schneide, as the psychologist, how would you approach that? Like if someone had a strong attachment to certain foods and they wanted to work through their, let's say, negative attachment or their anxiety around letting go of that food, how would you approach it?
Well, I don't really subscribe to the belief that we have to let go of certain foods to live a healthy life. I think everything is about balance. And I think that sometimes if we believe that we can never have a Coke or that we can never have sugar or, flour, whatever it may be, that it creates an experience around those things. They become sort of the forbidden fruit and the thing that we want more than anything. And so I think that it really is about balance. It's also about tuning into the body and listening to, well, how does it make me feel? I mean, if I'm drinking 5 Cokes a day and that's all I'm getting, and I'm not getting water and I'm not getting other things, how does that make me feel? Does it make me feel good? Does it make me feel, queasy and sluggish or bad? And really needing to kind of look at is that self-abuse at some level to be doing that to ourselves if it is causing harm?
Let me make sure I understand. Self-abuse in what respect?
That I think just as much as someone who's starving themselves, someone who's putting food in their bodies that's ultimately not making them feel good.
Got it.
Could be abusive.
Like self-deprecating almost.
Yeah, no, exactly. You know what? I was thinking, I agree with you, and working with that client, and I'm sure Lisa would agree with that moderation, taking steps is important. The one thing I have found is that certain people have these food triggers that they need to stay away from, at least for a while, just like someone needs to stay away from alcohol. Yeah. I was working with a patient last week, and he said to me, I can't have peanuts and I can't have ice cream because of those I just lose all self-control. So at least at this stage in trying to develop a healthy body image, he feels like he needs to stay away from that. So Dr. Nelson, as an aesthetic doctor, you deal a lot with the world of beauty, and how do you help someone, approach it in sort of a psychological, well-balanced way, not abuse, let's say, Botox or any kind of plastic surgery?
Sure. The initial assessment, first meeting somebody from the first glance, you can talk and sort of figure things out about people almost from the get-go. And when you have a chance to look at them as well, after talking with them, if you see, at least from my experience in injecting and doing minor things cosmetically, if you see that they're already taking their face has already taken a normal turn, if you will. I'm not sure how to
almost
describe
like
it.
body dysmorphia type
definitely
of
body
issue?
dysmorphia,
Okay.
without a doubt. It's almost
Actually,
like
I'm going
keeping
to
it
ask.
from
I
themselves.
just want Dr. Schneide to define to our audience. They may not know. Can you define what body dysmorphia is?
Well, body dysmorphia is actually an illness very similar to obsessive compulsive disorder, where people get really obsessed with different aspects of their bodies. We may not, to the kind of objective person outside of themselves, see what it is that's bothering them. We may see their nose and think that they have a fine nose, but they feel that their nose is misshapen.
Oh, okay. So it's that obsessive quality. So
there's a difference between, for injectors or for people in aesthetics, there's a difference between filling and augmenting. Putting something back that was once there is considered okay, especially if it gives a little lifting to the skin or et cetera. But if you're augmenting something like breast augmentation or lip augmentation, you're putting something there that isn't there presently to change your look, if you will. So there is a line to it, and I think there's specific patients we want to have in our door, and there's specific patients we probably don't.
So you try. Do you? I don't mean formally, but would you evaluate someone from a psychological point of view to make sure they understand what the results will do and won't do, and how will it affect their self-image?
Absolutely, and we make it a habit to take photos prior to any kind of treatment, so that you can show, even if it's minimal change, you can show something, some sort of gradual change.
Okay, so as if I was to walk into your office as someone who's getting older, how would? I'm just curious what the process is like a little bit.
Well, I'd kind of ask you what your goal. The first thing I'd ask you what your goals are.
I'm trying to get a deal here. Can't you tell?
You've already got one.
Oh, okay.
I would ask you what your goals are for your skincare,
right?
And what sort of lifestyle you live. Are you a beach goer? Are you somebody who's very active and you're outdoors all the time? Because if that's the case, there's certain things you can't do, and there's certain things I need to advise you against, or how to better prepare your skin and for its future if you don't change your ways. There's certain things we need from the outdoors, but we don't need hours and hours of it. So I'd ask somebody about their lifestyle first. That's a very important first question. Take a look at their skin in terms of assessing it would be the second thing I would do, and that takes about 15 minutes to get a beat on if somebody really cares about their skin, or what goal they actually have in mind.
That makes a lot of sense to me. It's also, a lot of times what you eat is going to determine how you look too. I know that if I eat certain foods, my skin will start breaking out, even at this old age.
Even if there's still a kind of a misnomer in medicine that skin or acne or those sort of changes in skin aren't affected by the diet, but that I think has been debunked.
Yeah,
now.
I think it's completely affected.
Right, we all believe in antioxidants. We all believe in certain minerals that we absolutely need, micronutrients. We believe in sunlight. So there's some things.
Yeah, I take that lesson from my dog. Every time the sun is out, the dog will go lie in the sun, and she must be getting some good vitamins from that. So Lisa, I wanted to ask you a question. Okay.
Yes.
Good nutrition. So I've been doing some CrossFit, believe it or not, and so there's the paleo diet, and now there's what, a keto diet or keto diet, which I don't even know what it is. There's about 20 different diets. How does one know what's right for yourself if you want to lose weight, get in shape? How do you pick the right diet?
It's very confusing, and it's become more confusing for even health professionals. I don't think there's one perfect diet for everyone. As a doctor was saying, lifestyle is important. I mean, if I have a bachelor come in who's 25 and never cooks, I'm going to recommend something different than a mother of 4 who cooks every night. It depends on your goals, but there are diets that can be medically harmful. Everybody wants a quick fix. They don't want to do the work. They want it now. They want it fast.
Yeah, Jennifer, how many times have we heard that?
Yeah. And so I think, when we're looking at the celebrities and we're looking at, now with social media being so popular and these Instagrams, which, has definitely affected body image and what have you, everybody wants to look flawless and perfect and thin. So these high protein diets look really interesting.
Appealing.
They want to eat meat and cheese and all that, but it puts you in ketosis, which is
I was wondering
not
about that because I see people eating, hunks of cheese and hunks of meat,
right.
and I just can't believe that it's that good for you. I mean, I don't know, maybe you're losing weight, but I don't know what it's doing to your insides.
The Atkins diet, for example, has been around forever, since the 70s, and it just keeps coming back in different forms. And now, the keto diet is sort of
what is
a
that,
different
the
type.
Keto diet?
Keto is short for ketosis, which in the medical field we all know is a dangerous state.
I see Dr. Nelson going,
or like a diabetic, right?
Yeah. You're basically cutting out carbohydrates and burning your fat. Well, you first start burning your protein, but then your body says, whoa, we're not going to do that. We're going to go to fat first.
Which sounds great.
Right, which sounds like a great idea, but your brain function doesn't work very well with ketones. Your body doesn't work very well over the long haul with ketones. You need a certain amount of carbohydrates in your diet. The thing that we throw around...
We're going to have to stop for a break, but you know what? This is important to me because I know, and I don't know if Jennifer has, Dr. Schneide has this experience, but I go to Whole Foods sometimes, and I'm so confused. I don't know what I'm supposed to buy.
Right.
I'm not supposed to buy pasta. I can't buy gluten-free, this, that.
Yeah.
I end up, having, a panic attack in the middle of the hall, in the middle of the aisle. But we'll come back and find out more about nutrition, and we'll find out more about how to psychologically prepare yourself for having a good body image. I'm Dr. G. The number again is 1-800-222-5222. Call in any questions you have to myself or to the panel. I'm Dr. G. We're back with Engaging Minds. So at the break, you guys missed it, but we were talking about different type of diets and the concept of food addiction. So we're going to share that information with our audience. But I'm going to put everyone on the spot for a second. I'm going to say, I just want them to tell me, when I walk into Whole Foods and I want to eat something, like what would, from a medical standpoint, what would be sort of my takeaway? What should I focus on to eat healthy? Is it high? Dr. Nelson. Sorry. Is it high protein, low carb, balanced Mediterranean diet? I can go on.
Again, I think it is person specific for what their needs may be. I think most Americans would probably benefit from lower carbohydrate, healthy fat sort of diet, a moderate amount of protein. You got to drink a lot of water during the day. That's one of the big things. That's probably the beverage of the day to drink is water. With everything, the other choices out there, water is still probably what makes us tick. So I think I'd start with that.
Okay, and Lisa, our nutritionist?
You mentioned the Mediterranean diet.
Right.
I think, it's the type of proteins that you choose, the type of carbs especially. Carbs are not the problem. You want to stick with the sweet potatoes and the whole grains, quinoa, things like that. You can have carbs and still lose weight.
Are potatoes a dirty word?
White potato. I eat potatoes.
Yes,
I'm a dietitian. I eat potatoes.
Right, confessional.
Not necessarily with butter.
Right.
But if you want to make baked fries or a baked potato and what have you, some brown rice, because when you don't eat enough carbs, you're going to crave sugar, and then you're binging on the junk.
Like you said, in ketosis.
And, yeah,
In
exactly.
ketosis, exactly. And as our psychologist, Jennifer, how would you recommend someone to approach dieting sort of from a healthy psychological point of view or a lifestyle change?
Well, from a healthy psychological point of view, I think rejecting the diet mentality is really key.
Agreed.
I think that dieting puts us in a state of mind where we immediately, just by the experience of going on a diet, we immediately feel deprived.
Right.
And that experience of deprivation, it's sort of like caging a tiger. What is the tiger going to do the second it gets out of the cage? It's going to go crazy and it's going to eat everything in sight. And I think that the concept of the diet does two things for us. First, it puts us into this mentality of like, okay, I've got to do the Last Supper before I go on the diet. So I'm going to go on this crazy binge. I'm just going to eat everything in sight because then I know I'm going to go on the diet. And then it creates this sense of deprivation when we're on the diet, so that when eventually we're never going to be on a diet forever, we're going to go off of it and we're going to go off the deep end. So my thought is walking into that Whole Foods, tuning into our inner intuition. There's a program called Intuitive Eating. I'm a huge proponent of this. I think that going in, really listening to your body signals. What is my body craving? I think human beings are born intuitive eaters. I think that if you have a child and you're feeding that baby a bottle, they'll turn their head away when they're done. They won't
I
keep
can,
drinking.
I keep making this joke, but I can even see it in my dog. When my dog doesn't want to eat and I try to feed her, she just turns her head around like she's done. I do want to add one element to that, and then we're going to take our caller. I agree with everything you're saying. What I was thinking about, I've also seen, is that if people go on a diet and then they fail, it adds the element of shame. Because most people, who have dieted have a lot of times dieted their whole lives and gone back and forth. So they keep building up this shame that they're failing. So if it's a lifestyle change and they realize, okay, I can have cheat days, I can do this once in a while, it's not so restrictive, I think it reduces the element of shame, which can help people be more sort of resilient in their dieting. That's my thought. But let's take this question. So we have Brenda from Newport Beach. She has a question for Dr. Nelson, actually, from who's representing Mid-Valley Hospice. Her question. Hey, Brenda.
Hi, Brenda.
Hi.
Hi. Why don't you share with Dr. Nelson what your question is?
Well, in regards to the right to die, the privacy issues involved with that, how obligated is, say there's a parent and a sibling that lives on one side of the country and the other siblings may be on the other side, and they make that decision without informing the others. Is that something that has to be done legally, or are they obligated to involve other family members?
So the Right to Die Act still incorporates patient confidentiality, as it's basically a HIPAA compliant act. So this is between patient and provider and practitioner. That's really up to the patient to discuss with the family. As difficult as it is, emotional as it can be for some of us, it's still patient-centered, and the patient has to make that request or has to reach out to the family and discuss it on their own.
Does that answer your question, Brenda?
That does. I appreciate it.
Thank you very much. Thank you for
Brenda.
calling in. And I do want to remind our listeners, I mentioned it quickly, but we would highly recommend Mid-Valley Hospice in Sherman Oaks. Their number is 818-386-2600. That's 818-386-2600. And if you're looking for compassionate end-of-life services, make sure you call them, ask for Anna, and she will be there for you. They're pretty amazing. So at the break, switching gears completely, I actually want to address my panel again. I actually believe in the concept of food addiction because I run a group for men who have had bariatric surgery and dealing with issues of obesity at the Kalili Center here in Los Angeles and actually in Beverly Hills. And I've definitely seen, like, again, it's not it's more anecdotal. I'm not doing research on it, but I've definitely seen a lot of men have a pattern similar to drug and alcohol addiction. And one guy I'm working with, when instead of saying he doesn't have willpower, when he said to himself, "I feel like I'm relapsing." As though he was an addict. Somehow that helped him more with the process. So I'm wondering what your feelings are about it, Dr. Schneide. I know they're very different than mine. But, and I do want to hear from Lisa and Dr. Nelson.
Yes. I don't actually subscribe to the concept of food addiction. I think that food is very different than addictive substances like alcohol and drugs. It's something that we can learn to have a healthy relationship with. I think that when individuals experience themselves feeling addicted to a food, because I don't deny that many individuals do feel addicted to food, addicted to chocolate, addicted to flour, or whatever it is, I think that it's coming from a very deep place of deprivation. It's coming from a place of, well, I can't eat that, so I'm not going to let myself eat that, but I can't stop eating it. And I think that once you legalize food and you make it okay to eat that particular thing, you might have a period of time where you feel yourself being out of control with it. But I think at some point it is going to end, especially if it's followed with or kind of treated with psychotherapy, where you're able to really look at the underlying issues. What feelings are you trying to cope with by using food in this way?
No, I couldn't agree with you more. I'm thinking more of sort of the patterns that are similar to someone, the behavioral patterns who is dealing with an addiction. To a substance or to food. But I have heard patients say, and I'm curious, I'm going to ask Lisa this and Dr. Nelson, that they feel when they eat certain foods that they can't stop, like foods that are high in sugar, fat, and salt. Mm-hmm. So and I know there's been research on this, so I'm just curious what your thoughts are on that, Lisa.
Well, as a dietitian, of course, we try not to get into the therapy aspect. And I have actually worked in drug and alcohol detox facilities where I teach nutrition during recovery. And so, we're doing one session on these individuals are coming off drugs and alcohol, and now they're going to turn to food. It's always when you're going off drugs and alcohol, you give the sweets and whatever. I mean, there's food all over the place because
Exactly.
they just want to make sure they're not going back to their
drugs
vice.
And alcohol, right.
And now then they're going to end up, in the bariatric.
Right. Or they start smoking
Exactly.
a lot.
Yeah,
right.
Exactly.
Right.
Or at AA, then they're outside smoking, but they're not drinking. So it's like we all have to have something, I guess. But definitely there are chemicals that go off in the brain, like, with the dopamine, the serotonin, when you're eating certain foods, whether it's the carbs.
Pleasure centers.
Exactly.
Right. What were you going to, I'm curious about that, the pleasure centers, sort of the biology behind it.
I think you're absolutely hit it right on the head with that we are a reinforcement type species. Mm-hmm. Our lives are based on reinforcement to a certain extent. I would think we all are. And so the idea of dieting, if we can go back just a second, when you were talking about that, I agree that having a diet is not the best idea, and it should be a change of lifestyle. And if you can do that, and you maybe eat what we call eat clean 6 days, cheat on day 7, mm-hmm. you're variably, intermittently reinforcing yourself, or maybe regularly.
Well, we're going to take a break, Dr. Nelson, but as I always think, I have something to look forward to. During the week, I can try to eat as clean as I can, and then to not feel guilty, like if I'm going to have a cheat meal, but really go for it and have that pizza.
Do you do that?
Oh, yeah.
Oh?
I did it. Usually after the show. It's my cheat night.
Tonight,
Yeah.
Sunday nights?
Yeah, but we won't go there. I want to go around to our panel, give them a chance to introduce themselves formally, and let you know, now that you've heard a little bit about them, if you want to get in touch with them, how you could do so. So, Dr. Nelson?
Sure. My name is Dr. Cary Nelson. I do work part-time as a medical director with Mid-Valley Hospice, like Dr. Gluss was saying earlier, and our phone number is area code 818-386-2600. I do have a private practice in Torrance at the Aesthetic Center, Torrance.com, 424-237-2622.
Thank you very much. And Lisa Defazio, if people want to get in touch with you, how could they do so?
I have a website, which is my name, lisadefazio.com.
Good choice.
Like Laverne, if anybody used to watch Laverne
Yes,
and Shirley,
I'm
Laverne
old enough.
Defazio, remember that?
Uh-huh.
Lisa Defazio, Defazio. And I do consulting work, media work, and again, I'm a registered dietitian with a master's in nutrition.
And Dr. Schneide?
I am a licensed clinical psychologist. I have a private practice in Valley Village near Studio City, and my phone number is 310-203-7890.
And I want to remind our audience, if you missed any of that information, you can always contact me, drhowardgluss at live.com, and I will forward their information to you. With the time we have left, I want to touch on an issue. I'm working with a teenager who has an eating disorder, and I'm curious. She obviously has a misconception about her body, but I know Dr. Schneide is an expert in this field, and there's a lot of, I want to say, unfortunately, a lot of adolescents dealing with it, really people of any age, and men too. How would you, in a nutshell, sort of briefly, if someone came to you, how would you help them deal with that issue?
Well, I think eating disorders are a very deep personal struggle. And I think that what is really going on isn't just about someone's relationship with food or their body, but it stems from a deep struggle with their relationship with themselves. And at the root of that is, kind of a profound lack of self-esteem. So interestingly, I think the treatment for an eating disorder really focuses on helping that person develop self-esteem. And that doesn't mean getting their body to look a certain way so that they can feel good about themselves. It actually has more to do with helping them become someone that they can love on the inside. It also has to do with doing things that are esteemable, doing things where we act in a loving way with ourselves, both physically by not abusing our bodies either by starvation or binging or purging, but also by doing really, really a lot of self-care, a lot of really loving acts toward the self. Little things like paying bills that need to be paid because they're stressing you out, to have them sit there unpaid. And knowing that by doing that, you're going to start to feel better about yourself. And it also has to do with, kind of changing the narrative that you use to speak to yourself. People often use really nasty ways of talking to themselves, very critical voices that run like a tape in their heads.
Yeah, because I feel with this, which we all know, there's so much pressure for these young people to, be whatever it is, a size 0, which to me means that you don't exist. I don't really understand it. But I mean, there's so if you're
true.
0, you just don't exist, I guess. But there's so much pressure, especially for young kids with Hollywood, all that they see in the movies, and a lot of these actresses are so thin. So I think it creates an unrealistic expectation. And I agree with everything you're saying, because what I think about is, what I hear over and over again is this person can't make a decision. She has no sense of self. She can't make even the simplest of decisions.
It's who am I inside of this body, which is really just at the end of the day a vessel to let us experience this life on planet Earth.
I agree.
And at the end of the day, it doesn't matter what that vessel looks like. What matters is, am I living my best life?
I agree.
And my most authentic life.
I agree completely. So, Lisa, from a nutritional point of view, how would you deal with someone who had an eating disorder? Because I know there's people out there hearing this information.
Definitely. It's I've dealt with eating disorder clients as well, and the issue which makes it more complex is they're teenagers and they're young girls, and they haven't maybe evolved yet, and they're still finding themselves. I'm not a therapist, but I've heard that, eating disorders also have to do with control. Oftentimes, I have had these young girls come in and their mother or father, usually the mother, unfortunately, had an eating disorder, and the mother is still not she's so paranoid about her own body. And so with the teens, you got to look at the parents. And oftentimes the parents are doing something, maybe they're very controlling and overbearing. So the food for that teenager is the only thing, or their body is the only thing that they can control.
And a lot of times it can be an act of, like you said, control, an act of power and control. Mm-hmm. It's something they may be able to sort of almost in a passive-aggressive way sometimes hold against their parents.
Right, because they aren't their own selves yet. They're under their parents' roof.
No, I think that's great information, and I'm curious. I see Dr. Nelson kind of nodding his head. So I think you've had experience in this area.
Yeah, I would. The approach I would take is multifaceted. I would actually involve everybody at this table. Like,
right?
Yeah. Not kidding.
But that is the approach.
Without a doubt. And I would probably have somebody, an exercise coach who's not a fanatic, but somebody who's like, look, this is going to keep you healthy, cardiovascularly speaking, right, and fitness and tone, et cetera. It could be anybody from Pilates to yoga, you name it. Mm-hmm. I think I would involve multiple people in the care.
Right.
I agree with that, and I would maybe try to keep the care away from, I want to say to Dr. Schneide, away from the parents, and have the kid, the adolescent, maybe choose what they want to do, not necessarily have the parents get too involved, because I do a lot of times also have that experience. It's a very enmeshed family, and the kid has no sense of just has no sense of self at all. So with the last few minutes, I like to go around and ask someone a question. I know a lot of times the time goes by really quickly, but someone may have a thought or feeling that they're holding on to, that they really want to make sure they get in at the last minute. So Lisa, any final thoughts, or to make sure that you don't leave here saying,
right,
I wish I would have said that.
I think, as the doctor said, people's health is multifaceted, and I think many people need a therapist, they need a dietitian, and also your medical provider. You need to see what's going on inside your blood, you need to see what's going on inside your head, and then we figure out what you're going to eat. And, just do what's right for you, and take advice from experts, not celebrities and self-proclaimed.
Or be careful what you read on the internet.
Our social media experts, quote unquote. Yeah.
Yes. Now, if you could just see Lisa's face on that one. Jennifer, anything you want to share with our audience?
I think that if someone out there listening is struggling with an eating disorder, just to know that they're not alone and that there is hope, and that it really does take a multidisciplinary team. It does take a psychologist, it does take a dietitian and a medical doctor to make sure that you're healthy, because there are a lot of medical complications associated with eating disorders.
Exactly, because I also think that it's that multifaceted approach that Dr. Nelson keeps talking about, and that's what I want our audience to hear. We started off the show talking about body psychology, how to have your inside match your outside and feel good about yourself, and that's what I love about what everyone's doing, is you're giving our audience great advice from a medical, psychological, nutritional point of view, that you could put it all together and do your best and give it a good shot, and don't worry about being perfect. But I haven't gotten to you, Dr. Nelson.
As a health care provider, and I think everybody in this room as well, we are at some point coaches for our patients too. Mm-hmm. We are advocates. I think we went into these professions to help people and to be, to advocate them and advocate for them if they can't help themselves. So that would be my take home.
I couldn't agree with you more. In other fields, people have consultants that they deal with, but Jennifer probably has this experience a lot. There's still a lot of stigma for a lot of people going to see someone for mental health issues.
Yeah,
which, I look at it and go, I get it on a certain level, but who does it all by themselves? Let's be honest.
And I think a lot of people are in therapy, but they're not publicizing it. And I think, we see so much, especially with social media, with mental health, and a lot of these celebrities coming out with bipolar and everything else. I think you have to put your ego down. You're not crazy. You're just being smart and get the help you need.
I mean, you would do it in other areas of your life.
Exactly. I tell people, if you're diabetic and you need insulin, you take insulin.
Right.
If, you're bipolar or you have anxiety and depression, you have to function in your life. And whatever help you need, it's really okay. Don't be so hard on yourself.
Well, I think that's it. Don't be so hard on yourself. And as Dr. Nelson knows, there's actually, taking a multifaceted approach. There's some good medications out there that can help you psychologically too. So I want to thank everyone for being on the show. We just touched on things. This was an amazing panel. We'll have to have them back for part
Definitely.
2. But what I want everyone to hear out there that, as the summer's coming up, don't do anything crazy.
Right.
Be sane. Get the help of a great nutritionist like Lisa Defazio, a great psychologist, Dr. Jennifer Schneide, and a so-so doctor. I'm just joking, Cary. Dr.
Thanks,
Cary
Alan.
Nelson, I guess I'm not going to get that free Botox, right? And
Just got doubled.
I just got double price. And there's a lot of help out there. There's a lot of qualified people. So as Lisa was saying, be sane and get the help that you need. I'm Dr. G. We'll be back next week. The number again is 1-800-222-5222. If you didn't get a chance to call in and want to email me with any questions, the email address is drhowardgluss. That's drhowardgluss@live.com. And I'll see you next week.